Welcome everyone. Let me just share my screen. Because we'll have a presentation here to share. Just one moment, please. Okay. Okay, can we all see the screen?
Yes.
Yeah.
Okay. So good afternoon, everyone. Welcome to the bi-monthly meeting of the African Cancer Support Group, ACSG. So my name is Ifueko Abajue, and I'm a member of the ACSG. And by the grace of God, I'm a breast cancer thriver who now supports others going through the cancer experience. Today, I will be facilitating today's meeting. So I would like to welcome everyone to today's meeting, especially those who are joining us today for the very first time. Welcome to the group. And for the benefit of those who do not know what the African Cancer Support Group stands for, I will now call on Mrs. Omara, a cancer survivor as well, and a co-founder of the ACSG, to tell us more about ACSG. So I will welcome Mrs. Omara now to tell us more about what the ACSG stands for. For those who don't know what we do. Over to you, Mrs. Omara.
Oh, hi, everybody. Again, my name is Florence Omara, and one of the co-founders of African Cancer Support Group. And why ASCG? ASCG stands for African Cancer Support Group. And why our group? We are here to help survivors and patients cope with emotional trauma caused by the cancer disease. And our main aim is to support survivors, patients, caregivers, and to share stories about our symptoms, share information about coping strategies, and share any new information that we can get to help everybody. And we are also a safe place to share information, coping skills, and mostly importantly, a place to give and get more information, emotional support. We are very serious about keeping our information safe. So anybody is welcome to talk whatever they want, because you know what? Cancer is not a thing that you can go on the street and play around with. So you're free to support, to share your information here, because the information is safe. And why join? Being in a support group can help everyone develop new skills to relate to others. So when people are sick, we are here with different types of cancers. But when I talked about my breast cancer diagnosis, from the day I was diagnosed to the end of the story, I'm sure somebody learned something new from me. And it's the same thing. That's the aim, for us to learn from each other and see how and develop new skills of coping with what we are going through. So who can attend our ACSG meetings? This is a group designed for specific audiences, including the Africans, Black individuals living with cancer, cancer survivors, cancer patients, caregivers, family members, and friends. Anyone interested in learning about cancer, because cancer is almost in every house. So we welcome you to come and attend our meeting and give us support. So we have meetings, bi-monthly meetings. We invite, so what we do is, Sister Yinka, I need to say something about Sister Yinka. She does most of this. I'm taking credit, but she does most of this. So she does, every month that we meet, we invite professionals And that is every second Sunday of every other month. So we have one now. So it means the next one is coming in August. So normally it's a Zoom meeting like this, and it's normally 2 hours, normally from 4 to 6 p.m. So by monthly meeting, it is only for ACSG members only to share and encourage each other. Our next meeting is July. Thank you.
Okay.
Yeah, thank you.
So thank you, Mrs. Omara, for that information session on the ACSG. And so now that we all know, including those who now know, who didn't know before, if there's anyone who you think might benefit from being a member, you know, cancer patients, cancer survivors, what have you, that is currently not a member, please feel free to invite them and invite them to join us so that they can get the support that they need. No one has to go through cancer alone, right? It's something that we experience. So, I mean, we just need to support one another to get through it. These days, cancer is not necessarily a death sentence. When we have the necessary support, we will get through it. So please invite whoever you know who is dealing with it to please join us. Thank you. Okay, so let's move on now to the main event for today. Yay! So today we'll be learning from a physician's perspective how we can stay well during cancer treatment. And this is a very, very important part of going through the treatment. How can you stay well during the treatment? And we have the honor today of sharing this information, these very valuable insights. Dr. Doreen Ezefe, she'll be sharing her most wonderful and inspiring ways in which we can do this effectively. And so I will introduce Dr. Doreen now. So Dr. Doreen Ezefe, she's a staff medical oncologist at the Tom Baker Cancer Center in Calgary, Alberta. She completed her medical degree at the University of Toronto. She did her internal medicine and medical oncology residency training in Calgary, followed by a thoracic oncology fellowship at Princess Margaret Cancer Center. And she has a Master of Science in Health Services Research at the University of Toronto. So Doreen's research focuses on cancer drug access, drug finding, and assessing the value of new cancer treatments. Doreen is the recipient of some prestigious awards for her important research, including the Novartis Oncology Young Canadian Investigator Award, Canadian Association of Medical Oncologists Fellowship Award, and she has received peer-reviewed grant funding from CIHR, I'm not sure exactly what that stands for, but it must be something big. The Alberta Cancer Foundation and Cancer Care Ontario. So that is an impressive resume. So please listen well and catch all the tidbits she has to share. So as the doctor presents, please feel free to type into the chat box any questions you have, as they pop up to your mind as she's speaking. Please type them into the chat box, the comment box, so that you don't forget. These questions will be answered when she has completed her presentation. So please don't forget to do that. So now please join me in welcoming Dr. Doreen Ezefe to make her presentation. Over to you, Doctor. I'll stop sharing my screen now and she'll take over.
Thank you for the lovely introduction. And I'd like to commend all of you for creating this forum for cancer survivors and cancer patients undergoing treatment and caregivers. It's really important. So I just want to confirm that you can see my slides.
Yes.
Yes.
Okay, great. So I thought it would be helpful to talk about how to journey through cancer treatment and do it well and stay as healthy as possible throughout this this time. You know, I see cancer patients, I give chemotherapy, some intravenously, and some of it is pills. And you know, patients undergoing this treatment, it can be a very tough time. And I do get a lot of the same questions over and over again from patients that I see that are undergoing chemotherapy. A lot of questions around what should I eat? How active can I be? How do I get better sleep? Should I take these vitamin supplements? And now with COVID-19, there's lots of issues and questions that arise. So I thought it would be nice to outline some recommendations around these areas of wellness and maintaining well-being throughout cancer treatment. And so I'll present for about 15 to 20 minutes. And then after that, I imagine that a lot of questions will arise. So I'm happy to open up a discussion so I can address questions and we can have more of a discussion, maybe to specific people, different people's specific situations. And if it's easier, please stop me along the way if you have questions that you want to clarify. So the first topic is nutrition. This is a big topic for cancer patients. Let me just minimize this here, especially when you're undergoing chemotherapy, whether it's intravenous chemotherapy or pill chemotherapy. And what I always say is that there really are no special recommendations for cancer patients. Everyone with or without cancer should follow Canada's food guide. And I think we've all heard of Canada's food guide. It kind of outlines what we should be eating and what portions we should be eating and how much of it should be coming from different food groups. So I think some of us have seen this picture before, which outlines that about half of our plate should be vegetables and fruits. And that's really emphasizing that we should be getting plenty of vegetables and fruits. Vegetables and fruits, as we may know, is packed full of all the antioxidants and the vitamins that really help cancer to regress and to slow down the progression of cancer and also facilitate the treatments that are being given. And the other quarter of our plate should be protein. So, and these proteins should be chickens and fishes or lean meats or legumes. And the other quarter of our plate, the remaining quarter of our plate should be carbohydrates, and really emphasizing with these carbohydrates that it should be whole grain, high fiber, you know, your brown rices, brown pastas. I know that's difficult. Of course, these are the recommendations. The recommendations really serve as an outline or a starting point, something to work from, or something to have as a guiding tool. Some patients with cancer will have severe weight loss. And this is because cancer makes nasty proteins that put the body into something that is called a catabolic state, or a state of feeling essentially like you're constantly running a marathon. So you're constantly burning energy because of these nasty proteins that the cancer is making. So that causes weight loss. And so a lot of my patients, especially I treat lung cancer, so more so with lung cancer than breast cancer, which I also treat, but lung cancer causes a lot of weight loss, and that's a very hallmark sign of lung cancer. And so the struggle may be in packing in those calories and packing in that nutrition to keep the weight up and or to promote weight gain, actually. And I'll offer some tips on that next. The recommendations are also to minimize alcohol consumption. There's emerging evidence in the past 3 to 4 years that alcohol is very much linked to certain types of cancer. So even small amounts of alcohol, it seems to be what we call a dose response relationship, where even small amounts of alcohol are associated with some small risk. So we just say, you know, we're all humans, we all have to live our life. So we just say to minimize alcohol consumption as much as possible. And these are really the tips in really achieving the best nutrition possible. And here we just outline all the tips that I just described. So again, it's eating plenty of vegetables and fruits, whole grain foods, and protein foods. And they recommend to choose protein foods that come from plants more often. So these would be things like beans and lentils and those proteins that are from the legume family, things that grow from the ground. Also choose foods with healthy fats instead of saturated fats. So fats that are your polyunsaturated fats or fats that are high in your omega-3 fatty acids would be more recommended than fats that than foods that have saturated fats. The recommendation is also to limit highly processed foods. So I always say to my kids, things that come in a package or in a bag are not as good for you as things that you get in the produce section. And I think something that I read that I like a lot is, when you're in the grocery store, you really should be spending the most amount of your time, and this is what we do as a family, in the produce section of the grocery store, and as little time as possible in the aisles, because the aisles are going to be all your processed foods, and the produce section is going to be all your natural foods, things that grow from the ground, whether it's potatoes or kale or broccoli or sweet potato or plantains, those things that all grow from the ground. And so they carry on to recommend that we prepare meals and snacks using ingredients that have little to no added sodium, sugars, or saturated fats, again, in line with the limitation of highly processed foods. Choosing healthier menu options when eating out. And it's nice that lots of restaurants now will include, the calorie menu, the food label and description as well. And I find that actually quite helpful, because the recommendations are actually to use food labels as a guide, because they do offer some tips as to what you're consuming. Make water your drink of choice. Many of us probably hear this either from our oncologists or other members of our community, that water is very good for us, especially in the hot days of summer. I usually recommend that my patients consume about 2 liters of water a day. So that's about 8 glasses of, what I usually say is 8 glasses of non-caffeinated beverages in a day, in a 24-hour period of time. So, and if you drink a cup of caffeine, then drink another cup of non-caffeinated beverage to compensate that, to balance that out, because caffeinated beverages are going to make us pee. They're diuretics, so they're going to make you lose water. So if you drink another cup to balance that out, then it can help to regulate that water loss. And that can be hard. What I do is I always carry a water bottle around with me throughout the day, and I'll just kind of chug from that. So you take swigs of water every 15 minutes or so, and that can help. Again, replace sugary drinks with water. Sugary drinks are nice once in a while, but the idea is to try and limit it as much as possible. Now, a bit more detail about this processed foods. So specifically about meat, a common question I get is, what about red meat and processed meat? Now, red meat is, as we know, any type of meat that's the muscle of an animal. So whether it's beef, lamb, veal, pork, mutton, goat, and processed meat is typically cured, salted, fermented, or smoked meat, such as ham, salami, which isn't that common in some African cultures, but in Canada it is more common. Bacon, sausages, things, meats like that. So these meats have been linked to colon cancer. And they're still studying whether there's a linkage to other types of cancer, but they certainly have been linked to colon cancer. So the goal that the World Health Organization and the World Cancer Research Fund want all of us to strive towards is, if we eat red meat, you limit your consumption to no more than 3 portions per week. So 3 portions is equivalent to about 15 ounces of cooked weight. So again, about that 1/4 of your plate, if you consider a plate size. And they say to consume very little, if any, processed meat. Now, here's another common question is, what about vitamin supplements? What vitamin supplements can I take to slow the progression of my cancer, to cure my cancer, to prevent my cancer from coming back? What should I take? And the answer is none. Nothing really can prevent cancer from coming back or slow the growth. There's no research that has proven with hard evidence, meaning randomized controlled trials with hundreds or thousands of patients, that this vitamin supplement can slow the progression of cancer or can treat cancer. The only vitamin supplement that's recommended in cancer patients, and everyone actually in Canada, whether you have cancer or not, is vitamin D. So I recommend vitamin D for everyone, especially people with darker skin. So us Black patients, us African patients, because we have more melanin in our skins. And as we know, vitamin D is made naturally by our body in sunlight. Sunlight converts cholesterol to vitamin D. And if we have more melanin, that's going to block out more of the sunlight. So we, as Black people, are at higher risk of being vitamin D deficient. And vitamin D deficiency may be linked to increased risks of cancer progression, and other diseases as well, such as heart disease, joint diseases, autoimmune diseases. So very much everyone with or without cancer should take vitamin D daily. I recommend 800 to 1,000 international units per day. You'll hear varying things from different doctors. As a cancer doctor, I recommend 800 to 1,000 international units per day. It's a fat soluble vitamin, meaning that you can take a bunch of it and it stays in your fat. It's stored in your fat. Vitamin A, D, E, and K are all fat soluble vitamins, so they stay in your fat, unlike vitamins B and C, which if you take too much of it, if your body already has too much of it, it will urinate out whatever it doesn't need. So what that also means is that you can just sort of take it when you remember. So what I do is I take it actually once a week. I'll take 7,000 units once a week. So I'll just take 7 pills once a week when I remember. So that's another way to do it if you have trouble remembering to take medication daily. Now, a note on natural health products and breast cancer. But breast cancer is obviously very common, and we hear that some of these natural health products they have been promoted to reduce hot flashes and other menopausal symptoms. But however, some of these products can contain what we call phytoestrogens, and phytoestrogens are compounds which have some estrogenic activity. And estrogen is a hormone that is made in women's bodies and everyone's bodies actually, but more so in women's bodies. And there is a risk that phytoestrogens may promote breast cancer growth or interfere with breast cancer medications, such as tamoxifen or your aromatase inhibitors like anastrozole and letrozole. So we tell people to be careful with phytoestrogens, and it's actually recommended to avoid using natural health products or supplements in the form of pills and capsules that contain phytoestrogens. And here are a list of some natural health products with known estrogenic activity. So these are the most common ones. This list is by no means all inclusive. There are some other natural health products that contain phytoestrogens that are not on this list, but things that we may come across most commonly that have been marketed to help with menopausal symptoms are things like ginseng, alfalfa, anise, bitter melon. A lot of my patients will ask me about tea tree oil, turmeric, wild yam, flaxseed, evening primrose oil. I think my mom takes evening primrose oil for menopausal symptoms, despite what I tell her. So the recommendation is to actually avoid taking these things when they come in pill form, capsule form, tablet form. So things that you would buy from a natural health food store. And remember that this list refers to supplements. So you do not need to omit these foods from your diet. So foods that have star anise or anise flower or flaxseed, you don't need to limit those foods or omit those foods from your diet, because the belief is that there are such small amounts of it in our diet that you cannot get to the concentrations that you would find in pills and capsules and tablets, where the phytoestrogens may be potentially dangerous. And there's specific recommendations actually about flaxseed and soy products. And I get this a lot. I get this question a lot because the feelings about soy products have been, I think, marketed a lot in the media, and so the general population does know about the potential risks of soy products. So we recommend to consume soy products and flaxseed in moderation, and that would be for ground flaxseed 1 to 2 tablespoons per day. And for soy products, 2 servings per day, okay? And so those are some of the recommendations around flaxseed and soy products and natural health products. Cancer cachexia, or severe weight loss, is an important issue that I thought was important to highlight separately. And one resource that is available to all patients is a dietitian. So if you're seeing an oncologist at the Tom Baker Cancer Center or any cancer center, they should have a dietitian that can support. Dietitians are actually the ones who created that list of natural health products that I just showed you, and they're the ones that issue these specific recommendations around diet. But they can help with severe weight loss. Severe weight loss is a big issue because it can impact treatment. Often with my lung cancer patients, my nurse will weigh them at every visit. So every 2 weeks when they come and see me, or every 3 weeks, they'll be weighed. I mean, every patient gets weighed when they come into the cancer center, but specifically around lung cancer, we look at the weight because if there's continued weight loss, then it can get to a point where it's no longer safe to continue chemotherapy treatments because the body is just too weak. And that's all cancers actually. If there's continued weight loss, then it's no longer safe to keep giving treatment. So we see that cachexia is very important because it can interfere with treatment. So I would advise any cancer patient to ask to see a dietitian if you've been trying and that appetite is not there, or you've been eating despite a low appetite and you just can't keep the weight on. A dietitian is a useful tool. They will offer some tips on high calorie foods and ways to really pack the calories in those meals that you eat. If eating food is an issue, so some patients, especially patients with nasopharyngeal tumors or who have had upper esophageal tumors or procedures, they're not able to eat solid foods. So what we recommend is dietary replacements such as Boost or Ensure. And what I usually say is I recommend a bottle of Boost or Ensure to replace every meal that is missed. So if you're only able to eat 1 meal a day, then you should be drinking 2 Boost or Ensure per day, 2 bottles of Boost or Ensure per day. If you're only able to eat 2 meals a day, then you should be eating 1 Boost or Ensure per day. Some people with diabetes have issues with the sugar in Boost or Ensure, and they do have a diabetes friendly, a low sugar version of Boost or Ensure. And I would definitely ask you to ask the dietitian for recommendations. They also have, for certain types of cancer, they have rebates because Boost or Ensure can be expensive. So a lot of pharmacies will have rebates that you can apply for to get your money back since you have a medical condition requiring you to take the dietary replacement. So I think it's important to know about all these resources and not just be unable to gain weight at home and be missing out on potentially life-saving treatment because of this weight loss issue. The next step is when all else fails, you can try prescribed medications. So if the step 1 and step 2 are no longer working, then what I will do is I will prescribe my patients with a short-term course of steroids, something called dexamethasone. And short-term means that you should not receive it for more than a few weeks because steroids have a lot of complications. As many of us may know, steroids have a lot of complications if they're used long-term. They can cause bone wasting, muscle wasting, increased risk of infection, high blood pressure. They can worsen diabetes. They can thin the skin. So there's a lot of really serious complications with being on steroids for more than a few weeks. So I like to think of steroids or Megace, which is a progesterone analog. It's a hormone. I like to think of these medications as a Band-Aid solution. They're very much a short-term solution because being on them long-term can have its problems as well. The last resort, if all else fails and there's still severe weight loss, then if that severe weight loss persists, then it will start to impact organ function, electrolytes, or minerals in the blood, to where it can impact the way the heart beats and the way organs are functioning, then you need to be admitted to the hospital for a feeding tube or IV nutrition, intravenous nutrition. And this is really last resort. This is usually not recommended because it's often difficult to, reverse out of that once we're back in that state, once we're in the admission to hospital stage. Treatment-related nausea. So many of us know that chemotherapy causes nausea. It's something called chemotherapy-induced nausea or vomiting. Oral chemotherapy causes nausea, intravenous chemotherapy causes nausea. It's a big issue because it can certainly impact nutrition. When you're nauseous, you don't want to eat. What I always advise is not to wait. So as soon as nausea hits, take nausea medication right away. This is very important because it becomes a slippery slope. So I know a lot of us, we try and tough things out. I'm the same way. If I have a pain or something, I just try and tough it out. But with nausea, that's related to chemotherapy, as soon as it hits, we should not wait. We should take nausea medication right away, because if we wait, the nausea gets worse and worse and worse to the point where we can no longer keep anything down orally because you're too nauseous to keep the medication down. And then you need to go to the hospital to get intravenous nausea medication. Eating well and staying well hydrated can help. Acupressure and acupuncture, there's actually a lot of evidence showing that acupressure and acupuncture can help. So I would advise, if you have tried other things and you're interested in trying acupressure, acupuncture, find a good acupuncturist and ask them about acupuncture for chemotherapy-induced nausea and vomiting. And if they're skilled in that area, they will be able to help you. These are the common oral anti-nausea medications that many of us are familiar with. The most common one is Stemetil or prochlorperazine, and the other one is more metoclopramide or Metonia, or Maxaran is another name for it. These ones are usually used as needed as the first step. And then dexamethasone. So as you can see, dexamethasone wears many hats. When it's not helping with appetite, it's used for nausea. It's actually a very strong anti-nausea medication, and we use it for a lot of our breast cancer. So a lot of my adjuvant breast cancer protocols, I use dexamethasone. And but as we know, it has a lot of side effects, and your oncologist should go over those side effects with you. If you have diabetes, you should be checking your sugars, because dexamethasone can make the sugars wacky. And then the strongest anti-nausea medications that I put here, just so people are aware that they are available to you as a resource. If these other medications are not working and you're taking them as recommended, you're taking them as soon as the nausea hits, and you're still having nausea, it's important to ask your oncologist or your nurse what about these medications. So olanzapine or aprepitant. And these are kind of our strongest nausea medications by mouth that you can take. And there's different doses you can use. I usually start with a 2.5 milligram dose of the olanzapine, because this olanzapine medication, so olanzapine is, if you Google it or whatever, you'll see that it's actually used as a medication for people with mood problems or psychological imbalances. So that's how it's actually been used for many, many years. And recently, in the past 10 years, we discovered that it's actually a very good anti-nausea medication for people receiving chemotherapy, strong chemotherapy that we use for breast cancer and lung cancer and colon cancer as well. So now we've started using actually for all cancers if people are still having severe nausea. The side effect is that it can make you quite sleepy. That is one of the main side effects. So that's why I usually start off with a small dose, a 2.5 milligram dose, especially in somebody who is naive to these types of medications, because you don't want to be, conked right out after taking this. Aprepitant is another strong anti-nausea medication that I like to try as well. And it's important to know about that medication as well. Exercise. So back to our wellness journey, we talked about nutrition, maintaining weight gain, nausea. So let's talk about exercise. And this is a topic I guess I get asked about, I would say daily, by my cancer patients, because there's different problems that may arise. So the first is that you're undergoing chemotherapy therapy and you're too tired to keep moving. You're just too tired, and that's understandable. By all means, it's exhausting. Your body is going through a lot. And then the other side of the coin is that you may be wondering, after completing your chemotherapy, when it's time to start exercising, or if you can exercise while you're undergoing chemo, if you're feeling quite well. So here's what we know. We know that exercise decreases the risk of dying from cancer. So this means that even in people with a cancer diagnosis, continuing on with exercise can decrease cancer mortality or decrease the risk of dying. Exercise lowers the risk of 13 types of cancer, such as colon cancer, breast cancer, prostate cancer, esophageal cancer, among others. Any exercise is better than none. So what I tell people is just try to move if you can. Listen to your body and do what you can do. You're not going to be running marathons while you're on chemotherapy. Some people are, but most people are not. Most people are too tired to be. I have a patient who, oh gosh, he was more fit than me. He was doing a kayaking trip in BC, and he was undergoing kidney cancer treatment. And so this was pill treatment, pill chemotherapy that he was taking. He was doing one of those portaging trips where you carry your kayak and you go in the backcountry terrain in the middle of BC somewhere, and you kayak from one location, you camp there, and then you kayak to another location. So that requires, as you can imagine, that requires a lot of physical strength. And he was doing that while undergoing chemotherapy. But I also have some patients who are barely able to get out of bed. And getting out of bed is a huge physical undertaking. And making the bed is a huge physical undertaking. And I have patients who tell me that they were out in their garden for 15 minutes. And I'm so proud of them because I realize how tired they are from the chemotherapy treatments that I'm giving. So what I say is that any exercise is better than none. And this is the general recommendation among international oncology societies, especially for people who are older than 65 years of age. We've seen that any movements, even walking down the street, walking around the neighborhood, stretching exercises, yoga exercises, stationary bike, any exercise is better than none. Just try to keep moving. Anything you can do. Listen to your body. If it's too much, stop, and rest, and do something that's easier, something that's less tiring, and try to work your way up if you can. Resistance training is also good as well, especially for breast cancer patients who are on some medications like letrozole or anastrozole that can thin the bones. I always say that you need some resistance training. So what's good is swimming, lifting, low to medium weights, bar, yoga, things like that. And for people who feel up to it, or for cancer thrivers, cancer survivors, people who have completed their chemotherapy treatments, who feel up to it, or people who are undergoing chemotherapy treatments who feel up to it, we exercising 2 to 3 times per week is the ideal, and this can reduce the risk of dying from cancer by about 30 to 35%. So, in exercise, we talk about something called metabolic equivalence. And many of us have probably heard about it, but one metabolic equivalent is how much energy you burn by just sitting here doing, talking to you. And it takes about 4 to 5 metabolic equivalents to do vigorous activity. So, going on a brisk walk or running on a treadmill. So that's why that's where the recommendation of 2 to 3 times per week arises. Sleep. Sleep is a big part of wellness, and sleep can be impacted, not surprisingly, by cancer treatments, whether it's the anxiety around treatment, the anxiety around nausea, the anxiety around having to come and see me every few weeks, whether it's different habits that people have around sleep, whether it's pain, different factors can impact sleep. So I always recommend to practice good sleep hygiene. And these things are obviously easier said than done, but it's still important to say these things as a reminder, because I even need reminders of these things and my kids need reminders of these things. So the first thing is to maintain the bedroom as a sleep sanctuary. And this means, so I always practice using the bed for sleep only. And not, spending lots of time in the bed when you're not sleeping, because then the brain gets trained to think of the bed as a place for play and not for sleep. Recording. Okay, great. Doing a skincare routine and then brushing teeth and then going to bed. So something that involves, a routine that you do the same thing of every time before sleep. And then also some things to avoid. So mainly avoid drinking any liquids less than 1 to 2 hours before bedtime. I'm guilty of this. I'm guilty of, being the most thirsty right before bedtime, guzzling a bunch of liquid and then you're up to pee every 5 minutes once you're in bed. So if sleep is an issue, then I would definitely pay attention to that. And then avoiding screen time immediately before bed. So I like to have a good book by my bedside and read that, and that kind of quiets the mind a bit. Certainly, if you've tried all these things and sleep is still an issue, I would certainly ask to see psychology or psychiatry, especially if anxiety is felt to be an impact. Sometimes before, a CT scan or an MRI, before seeing your oncologist, you may be lying in bed thinking about all the things, or thinking about all the recommendations, or different thoughts that may be racing through the mind. I think that a good resource is psychology or psychiatry, and it's good to ask your healthcare team about seeing someone if you've tried everything else. Now, what about alternative therapies? This is a very common question, and there actually is some data on the benefit of alternative therapies, certain alternative therapies, for mood disorders and nausea and vomiting associated with chemotherapy. So meditation, yoga, massage, and music therapy are recommended for depression and anxiety, and they have been shown to benefit. Acupressure and acupuncture, again, are recommended for reducing nausea and vomiting from chemotherapy, as we said. And there's not enough evidence yet to support dietary supplements or dietary modifications. And in dietary modifications, specifically, I'm referring to things like the intermittent fasting diets or ketogenic diets. There is a lot of emerging data. There's a lot of research right now in these areas. Currently, trials are being conducted to obtain some more hard evidence. And what I mean by hard evidence is evidence, as I said before, that is comprised of hundreds or thousands of patients who are undergoing cancer treatments. So not what we call case studies or anecdotal evidence, which is one person's story of how this ketogenic diet worked for them. That's often not enough for us to be able to issue recommendations to the general population about something, because just because it worked for somebody's aunt's niece's brother doesn't necessarily mean it will work for you. So we need data in a uniform and heterogeneous population to be able to make recommendations. Now, I feel like you can't give a talk nowadays without saying something about COVID-19. So I thought it was important to highlight what the COVID-19 recommendations are in cancer patients. Many of us know this already, but it's nice to have a reminder. And also these slides will serve as a resource for people. So again, we recommend to get fully vaccinated against COVID-19. Cancer patients can receive mRNA vaccines, whether it's Pfizer or Moderna. Ideally, we recommend this at least 2 weeks before chemotherapy is initiated. So that's because chemotherapy is going to suppress the body's immune system. And these vaccines are an attenuated part of the COVID-19 virus that is going to mount an immune response in the body. And if the immune system in the body is a bit weakened by the chemotherapy and it's not able to mount a sufficient immune response, then there's going to be difficulty. So that's why we recommend you allow 2 weeks before starting chemotherapy after receiving the vaccines. The clinical trials, as many of us know, did not include cancer patients, patients undergoing chemotherapy. Those patients were all excluded, just like children were excluded, just like pregnant and breastfeeding women were excluded. So these are considered special populations. And what we're doing is we are extrapolating from the evidence that we have in the non-special population for cancer patients and patients undergoing chemotherapy. What we do have is what we call real world evidence, which means that it's not research that has been conducted in the uniform clinical trial environment where everything is very controlled, but it's evidence that is just from people living their normal lives. So when people come into clinic and they see them, then they gather that evidence and they look at registries or large databases, and that's how they see, then they follow people to see who got sick, who lived, who died. So what they've done is they've looked at this evidence, how people did with the COVID-19 vaccine, who had cancer, who did not have cancer, who were on chemotherapy, who were not on chemotherapy. And it seems that the COVID-19 vaccines are just as safe in people who have cancer and people who don't have cancer, and people who are on chemotherapy, who are not on chemotherapy. Safety data seems very similar in these two populations. So that's certainly reassuring. And then, of course, continue to practice recommended public health measures like wearing a mask and socially distancing. I don't know when we can all stop wearing a mask, but hopefully soon. So I thought it would be nice to end on this slide, which kind of summarizes the recommendations that I've spoken about. This is geared towards cancer prevention, but it also says here that after a cancer diagnosis, continue to follow these recommendations if you can. So this really emphasizes that the recommendations actually don't change a whole lot for people who have a cancer diagnosis and those who don't. So, maintain a healthy body mass index, be active, eat a diet rich in whole grains, vegetables, fruits, and beans. Like we talked about, limit consumption of fast foods and other processed foods that are high in the bad fats, starches, or sugars. Limit consumption of red or processed meats. Limit consumption of sugar or sweetened drinks. And limit alcohol consumption. Do not use supplements for cancer prevention. They have not been shown to work. And for mothers, breastfeed your baby if you can. This stems from evidence that breastfeeding can lower the risk of breast cancer. And after cancer diagnosis, continue to follow these recommendations if you can. It's always helpful to have some credible resources. I think that in this era of widespread internet use, we are inundated with information. You can just Google anything, and sometimes it's not so clear what is credible and what is not. So I think it's nice to have a compilation, and this is just actually a compilation of a lot of the resources that I used in this presentation. The American Society of Clinical Oncology is an international cancer body that is housed in the United States, but is very much international. And they issue guidelines, and they also have a yearly conference where they publish the most late breaking data, and they just finished that conference actually last week. So it's nice to know about this resource because it has the most credible information, the most credible resources. I would always check the year when something was published or when something was released, because as we know, we learn more as time goes on. So, my kind of rule of thumb is trust something if it was researched from the last 2 to 3 years. If it's older than about 2 to 3 years, it's probably a bit out of date, and I would probably want to make sure that we still feel the same way about something. You know, for vitamin D is a great example. You know, our feelings about vitamin D have really evolved. Like 10 years ago, if I was giving this presentation, I would say very different things about vitamin D, but now we feel we have learned more, we've done more research, and so yeah, very much look at when something was published. And then the World Health Organization, World Cancer Research Fund are very useful resources as well. Canada's Food Guide, and the National Advisory Committee on Immunization. I think CBC and a lot of the Canadian media outlets actually cite the National Advisory Committee on Immunization a lot when they talk about COVID-19 vaccine specifications, but they have a nice section on special populations that I quite like. So I can open it up for questions at this time. Thank you.
Okay, thank you so much, Dr. Doreen. This has been a very enlightening presentation. And we do have some questions waiting in the chat box. So I would ask you those questions so that you can enlighten us some more on what people are asking. So the first question is, what would you suggest for drowsiness and dizziness?
For drowsiness and dizziness?
Yes.
Yeah, so it depends on what is causing that. And so usually what I like to do is take a more detailed history on what exactly we mean by drowsiness and dizziness. So dizziness, actually the true medical definition of dizziness is when feeling like the room is spinning or like you're spinning. But the general population, non-medical people, often use the term dizziness to refer to lightheadedness, or when you stand up or even just are just sitting there and you feel lightheaded, like just faint. And so that's what a lot of people refer to as dizziness. So if we're referring to the room spinning or like you're spinning, then that's something called vertigo. And that's a more specific history. And I would need to do a physical exam to get a better sense of what is causing it. And then there may be some imaging that would need to be done to clarify what the cause of that is. Because again, vertigo can be due to an inner ear problem or a brain problem, or something called BPPV, a benign cause of vertigo. And if it's lightheadedness, then which is most commonly what people are referring to when they say that they're dizzy. The most common, again, I'll just say the most common causes, but these things have like 20 causes, of course. But the most common cause of lightheadedness is often dehydration. So yeah, lots of fluids, lots of water, and that can help. If you're drinking more than 2 liters of liquids in a day and you're still lightheaded, then I would seek medical attention, and we need to look further into what's causing that.
Okay, thank you. Another question here is on alkaline water, and I know I heard this quite a bit. How does alkaline water help the body during cancer treatment?
Yeah, that's actually one I didn't mention. I mentioned the ketogenic diets and the intermittent fasting. Alkaline water doesn't help. Your body does a very good job at maintaining the ideal pH in order to sustain human life. If you're drinking alkaline water, your body is just returning your pH back to normal in order to be able to keep our heart pumping and keep all your organs functioning well. So I would say don't waste your money on alkaline water.
Okay. So I hope that helps the person that asked the question. Okay, and then another question here is, what lifestyle choices will you recommend to mitigate cancer occurrence or reoccurrence? I know you probably have spoken on that a little bit, but if there's anything else you would like to add, please go ahead.
Yeah, so that's a great question. Yeah, so I will just go back to my last slide. All of these measures really do help. These are the recommendations. So I know it's difficult to live a life where you're, not eating red meats or processed meats and not drinking sugary drinks. So I say everything in moderation. So, once a week, once every few weeks, if you want to have a nice drink, that's certainly allowable. Other things to minimize the chances of cancer coming back, the biggest one would be exercise. We have a lot of data showing that exercise really does prevent cancer. As I mentioned before, it decreases the risk of 13 different types of cancer. So all of us should be exercising. It's not easy. It's easier said than done. But I cannot emphasize enough the importance of exercise, just moving. And there's actually a linkage between, the flip side of that is being sedentary. So there's actually a linkage between being sedentary, which means, sitting on the couch or anytime that we're sitting. So they studied people who are sitting down more hours of the day, and they looked to see how many of them had developed cancers. And they saw that the more hours in a day that people were sitting, the more chances you have of developing cancer. So the very much try and limit the amount of time that you're sedentary or sitting down or not moving around. Moving our body really does help to limit the chances of developing cancer, having a cancer recurrence. So that's the biggest thing I would say is exercise. Obviously, we have to do it safely and listen to our bodies, and do it in moderation. But what I would recommend aiming for is that 15 metabolic equivalents per week.
Okay, thank you so much for that. So guys, you've heard it. It doesn't matter if you're big or small or slim or fat. That's not the issue. We all need to exercise. Exercise is required for life. So let's go out there and walk. The weather is great now, so no excuses.
Yeah.
Okay, we have another question here on Kangen water. I haven't heard of that before, but do you know what that is, Dr. Doreen?
How's that spelled? Let me just see the chat. Kangen. I actually haven't heard of it.
Oh, okay.
Is that a type of alkaline water, or is that a type of?
I'm not sure.
Okay, I actually haven't heard of it. I'd be interested. If I haven't heard of it, there's probably no hard evidence associating its benefit in cancer patients, but I'd be interested to know more about it.
Right. And there's another question here on Zumba dance. I know you've talked about exercise, but what do you have to say about Zumba dance specifically? Is it okay for cancer patients?
Oh yeah, Zumba's great. I used to love Zumba dance. Now the gyms are all closed, but I think Zumba dance is great. I think if you are wet it well enough and feel strong enough to do it, then sure, by all means, yes, Zumba dance is certainly okay. Yes, right. Dancing. Excellent. Everyone needs to dance. Dancing makes life better.
For sure. So the organizers of ACSG, maybe you can organize a dance party for all of us. That might be a good activity for us to do. Take notes, please. Okay, I have a few more questions here. So I know, like, I've gone through cancer, and during the treatment, I started having a lot of cravings. You start to crave things, like even things that I ate last when I was even a teenager. I started craving them. So how do you deal with those cravings when you're trying to watch what you eat? I mean, a lot of the cravings I had was for carbohydrates, right? And I knew I shouldn't be taking a lot of carbohydrates. So how do you deal with that conflict where your body is craving something you need to eat, but what it's craving and the quantity it's craving is not necessarily the best? What do you do in that situation?
Yeah. Well, I know that it might be linked to satiety, or because different foods have different abilities to make us feel full. So if you eat something that usually more processed foods tend to be linked to poor satiety or not being able to help us feel very full. So that's why when we eat a bag of chips, when we eat 5 potato chips, we want to eat more because we're not feeling full. Whereas some foods like chia seeds and yogurt, for example, are more satiating, or avocado or quinoa are more satiating. They make you feel more full, or oatmeal. And they also don't cause those insulin spikes in our body, which is a whole nother topic, but they kind of release the sugars in your bloodstream slowly. So I would look more into the types of foods you're eating to satiate yourself. So the types of foods you're eating to help you feel full. The other thing I do actually, and this is a tip I actually got from a colleague of mine who was trying to lose weight. And so when you drink lots of water or lots of fluids right before you eat something, then that helps you feel full. And so, because sometimes dehydration can mask itself as hunger. So what I do before a meal is I'll try and, drink a couple of glasses of water, and then I don't eat as much. So that's also another helpful tip. But certainly if weight loss is an issue, then you don't want to do that. You want to just eat and gain weight. Oh, sorry about that. I do have to
Thank you.
go soon. Sorry about that.
So I have another question here on what is the best way to control lymphedema?
Lymphedema, that's a great question. And it's a very common problem in breast cancer patients, all cancer patients, especially if you've had the axillary lymph node dissection. For lymphedema, it's difficult after the axillary lymph node dissection. A sleeve is always very helpful because it helps them push that fluid back. A lot of people, especially in the heat of summer, don't like wearing a sleeve. And I know that some people have found acupuncture to be helpful. We have a lymphedema clinic at the Tom Baker Cancer Center. They're lovely. They're on, it's actually, at the Holy Cross. And they meet once a week. You can book appointments once a week on a Wednesday. So I would ask maybe your oncologist to refer you to the lymphedema clinic. It's run by a group of lovely physicians and nurses.
Okay, sounds good. I've also heard that exercise helps to control it. Is that true?
Yes, that's a very good point. Exercise is another tool. Yeah, that really helps. Typically exercises that help to elevate the area of lymphedema. So usually, most commonly it's the arms. So exercise that helps to elevate the arms more and keep the arms kind of above the head or the legs above the head. Those exercises really do help to move that, to mobilize that fluid.
Right.
Okay, the more sedentary we are, the more edema we have. So, right. Even walking and things like that certainly help.
Okay, thank you. Back to exercise again, so we can't get away from it. Okay, I have another question, and it's sort of related to the one on cravings. So when I was going through chemo, I couldn't drink water at all. Like water tasted bitter in my mouth. And you mentioned that we need to hydrate a lot. So how do you deal with that?
Yeah, that's a great point. And that's probably something called dyschezia, or when chemotherapy makes food taste bad, or water, anything that you put in your mouth tastes bad because of chemotherapy, because chemotherapy changes our taste buds. And it's very difficult. It's demoralizing because you're on one hand you're being told to eat and keep your weight up, but on the other hand you already have poor appetite because of the proteins from the cancer, and you have poor appetite again because when you put anything in your mouth it tastes awful. What I would recommend, and then also mouth sores can be an issue. So outside of the dyschezia or the poor taste, mouth sores are an issue as well. So, controlling mouth sores certainly, and I didn't talk about that, but there's a lot of medications that can help to control mouth sores. Outside of medications, there are conservative tools. So I recommend ginger ale often for altered taste and also for mouth sores. Sucking on ice cubes helps as well. They have those little lollipops that you can dip in ice in the hospital, and so you could create some sort of what I do is I freeze juice and put a popsicle stick in there, and then you can suck on that to help. And then to drink water, if water tastes bad, there are those water flavoring packages that you can buy. I know when we did Mount Kilimanjaro, we had I think they're called Mio. You get them from the grocery store. One brand is called Mio. There's many different types, and you just put a little squirt. They have different flavors. Whether it's strawberry or lemon or whatever. And then you just put them in the water and they make the water taste quite nice. As I mentioned, just lemon, also cutting up a lemon or a lime and putting it in your water, strawberries, any fruit, and putting it in your water. And the last thing is smoothies. So we could just give up on water for a bit, a few hours of the day. If it's tasting too awful, you can try smoothies. And in smoothies, you can put water and also milk. So what I recommend to my patients actually, as a good weight maintenance tool, is to make smoothies. And smoothies you can really make out of with anything you have. So you can take an avocado and a banana and some milk. That's how I make smoothies for myself. And I just blend that in the Magic Bullet or whatever blender you have and just drink that. Or any fruit, strawberry, mango. Mango's a delicious one because it really sweetens it quite nicely. You can mix a bunch of fruit in there, even vegetables. I know a lot of my patients will put spinach and kale and a bunch of things in there, and that tastes quite nice. You can even put a little bit of sugar too. I know I said to limit sweetened drinks, but I think when it's all about minimizing harm and trying to get through your treatment. So if you're on cancer treatments and you're trying to finish your treatment, it's to the point where you're not able to maintain your hydration and you're not able to maintain your weight because you can't taste things properly, then it's more important to just maintain your weight and your fluid intake. So at that time, it's okay to, add a little bit of sugar to sweeten your smoothie or whatever it is, so you can maintain your weight and your hydration.
Right. Okay, thank you so much for that. Then one more question I have here, I believe is the last one. I know you talked about vitamin D,
Yes.
and you usually recommend 800 to 1,000 IU for your patients. And you did
Yes.
mention that other doctors have their own criteria for prescribing.
Yes.
Would you say that there is, that one can take an overdose of vitamin D? Because I currently take 2,000 IUs. My
That's
husband
fine.
takes 5,000 IUs based on his own research. So
Yeah.
what is the maximum you can take without doing harm?
There is something called vitamin D toxicity. It's very rare, though, very, very rare. And it's linked to a bunch of other factors like kidney problems and things. So it's super rare to overdose on vitamin D. It is, I guess, in the realm of possibilities, but it's super rare. I think 5,000 is too much. That's my personal opinion. Everyone has their own opinion. The internet is a wild thing. People read all sorts of things. I said that there's a variation in physicians, but I would say that generally family doctors, you recommend 400 to 800 for Black patients. For persons of, I don't really like the term persons of color, but minorities, Black patients, people with darker skin color, I usually recommend 800 to 1,000 because we need more because of the melanin. But yeah, 5,000 is probably a bit too much is what I would say. But again, you listen to your individual doctor.
Right. Okay. Thank you. And okay, I said that was the last question. Sorry, we have another question that just came in.
Of course.
Okay. So back to red meat. I was advised to increase my red meat and spinach intake for my low hemoglobin. I'm currently at the last stage of chemo for Hodgkin's lymphoma. What will you advise concerning red meat to people with tendencies of having low hemoglobin?
Yeah, that's a great question. So I would advise, so the reason they were asking you to increase your, red meat and spinach is because of iron. So iron, it helps hemoglobin. It helps to transport oxygen to our organs in our body. So that's what we need iron for. So the key there is they're looking for iron. So you need to eat foods that are high in iron. A lot of things are high in iron, not just red meat. So lentils are a high source of iron. I have a 9-month-old who obviously has barely one tooth coming up. So she can't chew red meat, but she needs iron. So I give her lentils, right? We puree lentils for her, chickpeas. There's lots of legumes that are high in iron. There's different types of iron, which you may have been told by your oncologist. There's heme iron and non-heme iron. You want to take iron that is going to be easily absorbed. And vitamin C helps to absorb iron. So you want to take it usually with oranges or lemon or something that has vitamin C. So what I would do is Google foods that are high in iron, and that will give you a list of other things outside of red meat that you can eat. And then if worse comes to worse, there's also iron supplementation that you can take.
Okay, thank you. Thank you so much. So that was the last question, Dr. Doreen. Thank you so much. Your talk has been so valuable to us. Mm-hmm. And hopefully we, go do what has been said, because if we just hear it and don't do it, then it doesn't do us any good. So guys, you go out and do what you need to do to keep cancer away. Dr. Doreen, thank you so much. Thank you so much. I believe these slides will be available to us. I don't know.
Yes, okay. I did email them to the group.
Okay.
To the African Cancer Society group.
Right. Yes, I have it. Yes.
Yes.
Okay,
yeah.
Probably share it with us later. Great presentation. Everyone is talking about your presentation, and they're saying thank you so much. So thank you again, Dr. Doreen.
Well, thank you for organizing this forum. I think it's so important, and please keep it up, whatever support you need. I think it's really important to have this community and this support. It's important for our patients to know what resources are available to us and what the best information out there. We need to be empowered with this information. So I really appreciate that you have this community.
Thank you. So if you can please stop sharing your screen so that I can go on with the rest of the presentation. Thank you.
All right. Let me just figure that. Let's just see here. Pause share. How do I? There we go.
Okay. Thank you.
Thank you. All right. Take care.
Yeah, thanks.
Bye.
Yeah. Okay. So we are back to the rest of the presentation. I hope we did get a lot from that, from Dr. Doreen. Okay. So now I will ask Mrs. Yinka Oladele to give us the announcements that she has on her table.
Thank you, Ifeko, and I will get back to Dr. Iseife later. Thanks everyone for coming. For those, can I go to the next slide?
Okay.
For all the ACSG members, we have reached an agreement with Dr. Laurel Stewart. She's offering 20% for acupuncture and massage. And we also add Dr. Doreen that acupuncture is good, acupressure is good. So she was going to give 20% discount, and also ACSG will also offer 50%. So which means you are only paying 30% of whatever it is. So for all the members, just let me know, send me, or you can put it in the platform. Some people have said that they are interested. So that we'll take care of that. Also, in August, we'll be having a dietitian and a registered nurse. So that we'll talk about diet, we'll talk about food. I know she mentioned them today, but we'll really go deep into them in August. In July, the next slide. In July, this is for members only. In July, we'll be having the integrative wellness practices, and that will be handled by Mrs. Ifeko Abajue, our host today. When we have members only, members are able to share, they're able to talk, we're able to hear about everyone's journey. When it is general like this, we don't allow people to talk about their business when it is general, but when it is just members only, then we'll be able to talk, we'll be able to encourage ourselves, we'll be able to give words of hope, words of encouragement. And that will be on July 11. We'll also send out the reminder and the Zoom link. It's going to be from 4 p.m. to 5 p.m. So if you have any question or you would like to know more about the ACSG, these are the phone number, Mrs. Somara, Mrs. William, Mrs. Ifeko, Sheung, and myself. Or you can go on the website, africancancer.ca. You can send us a message. Also, next, please. So like I said, next general meeting is going to be August 15th. Please save the dates.
and we'll see you on that day. Next. So if you know, like I said earlier, that will be offering 50% for acupuncture, for massage. If you know anyone that would like to fund us so that cancer patients don't have to pay anything, I don't like people paying. I like to look for funding. I like people to donate to us. You can go on our website, you can send us email, or you can let us know if you like to connect us to any funder that can fund this. We are not for profit, and whoever donates, you have tax receipts for your donation. Next, please. And for those with myeloma, that's the myeloma patients. Myeloma is cancer of the bone and blood. They have something to do. They are presenting everything you need to know about amyloidosis. And it's going to be also from a professor from University of Calgary. It's going to be on June 22nd. We'll put it on our website also, and also put it on the WhatsApp forum for anyone that would like to attend. It is free. It's also online. Everyone is welcome. You don't have to have myeloma, because all these things, they are information that we all need to know how it is done. Next. Thank you so much, and I pass the remarks to Mr. Bayo Oladile.
Closing remark. Okay, good evening, everyone. And I just want to say thank you so much for everybody that have participated, especially our host today, Mrs. Ifeoko. We really appreciate you being around. You always energize the meeting every time. We really appreciate you. And so we're looking forward to your presentation next month. We want to say thank you to our doctor today. I think she has dropped off already, but this will have been an opportunity for us to really recognize her and to say thank you for what you gave to us. We will still do that, I mean, at the back end. But, you know, I think today has been very, very successful and resourceful and beneficial. It doesn't matter what type of cancer you have, or it doesn't even matter if you do not have cancer, right? A lot of information that was passed across today will benefit each and every one of us. So really thank you, our doctor. To everybody else that came around, we thank you for taking the time. I know that on a very wonderful, beautiful afternoon like this, there are so many things we could have done with our time, but you have participated and joined us, so we really appreciate you. We also wanted to spread the news that if you know anybody, an African, anybody of that color that is going through cancer, please direct them to us or let us know where they are. Cancer is not necessarily a death sentence again. Cancer is no longer a taboo. Let us discuss it. By discussing it, we're taking away all the mysteries or the whatever mysticism that surrounds it. And that helps us to, you know, to help ourselves. So, you know, thank you so much for everything. And I will pass it over back to our coordinator today. Thank you and have a wonderful day. Bye-bye.
Sorry, before we leave, she mentioned yoga and Zumba. I think we'll be organizing that. So whoever is interested in yoga, I know Dr. Laura, she does yoga as well. Now that COVID is going, maybe we'll rent a place and we can have Zumba or we can have yoga. I will let you know, even if we can do it online. I've done so many Zumba online, like since last year, I cannot even count again. But if we want to do it online, that is fine. If we want to rent a place, that is also good. But I will let you know once we get somebody that can do it for us. So once again, thank you so much for coming. Let's see your faces. Let's take a picture. So stop sharing. Stop sharing, everybody. show your face. Okay.
Stop recording.
Yeah. So let me stop recording.